Thanks, Jen. Two subject areas. First, an APNRC survey found that 45% of the unvaccinated say they will definitely not get vaccinated. Another 35% say they probably won't get vaccinated. Why does this opposition still exist after all the public outreach? And should more governments and employers mandate vaccinations?
Well, Josh, I think let's take a step back first. In December, before the president took office, the percentage of Americans willing to get a shot was in the 30s. Today, over 68% of adult Americans have taken a shot. So what that shows you is that in a relatively short period of time, we've been able to influence a whole lot of people to change their mind, to take action, get a shot, save their lives and the lives of people around them. I'd also note that we've seen some encouraging data over the last couple of weeks. The 5 states with the highest case rates, Arkansas, Florida, Louisiana, Missouri, and Nevada, had a higher rate of people getting newly vaccinated compared to the national average. That is a good sign. This is the second week in a row. I noted this last week. Finally, in the past 10 days, more than 5.2 million Americans have gotten a shot. Now, there will be institutions, there will be private sector companies and others who make decisions about how to keep their communities safe. That's certainly appropriate, but I would just note that we're going to continue our efforts to go community by community, case by case, to convey the accurate information about the efficacy of vaccines.
Alabama's Republican governor says it is time to start blaming the unvaccinated folk who are letting us down. What do you think about that take? Should the administration be taking a sharper tone against unvaccinated people for putting vaccinated people at risk?
Well, I don't think our role is to place blame, but what we can do is provide accurate information to people who are not yet vaccinated about the risks they are incurring, not only on themselves, but also the people around them. And, well, if you are a young person, you may think you are Superman or Superwoman and immune from getting the virus. That is not true. That is not accurate. You can get very sick. You can die from the virus. You can also make your grandparents sick and your parents sick. That is factual information. We're not here to place blame or threats. We're here to provide accurate information.
She says that she doesn't know what else she can do at this point, that she's hit a brick wall with trying to convince people to get vaccinated. Mm-hmm. Is that a sign that perhaps the federal government should step in and issue mandates? And if not, are you putting the needs of unvaccinated people ahead of the needs of vaccinated people?
Well, I think the question here, one, that's not the role of the federal government. That is the role that institutions, private sector entities, and others may take. That certainly is appropriate. Also, local communities are going to take steps they need to take in order to protect people in their communities. I will say we understand her frustration, and we understand the frustration of leaders out there and public voices who are trying to say the right thing, advocate for the efficacy of the virus, save people in their communities. What our role is, and what we are going to continue to do, is make the vaccine available. We're going to continue to work in partnership to fight misinformation, and we're going to continue to advocate and work in partnership with local officials and trusted voices to get the word out.
And is there something to be learned from our neighbors to the north, Canada? They got a much slower start. They didn't have nearly as many vaccines as we did early on, and yet now they've shot past us, and 70% of their population is at least partially vaccinated. What's the difference between the two countries? What can we learn from their experience?
Well, first I would say 162 million Americans are now vaccinated. That certainly is a positive step. We're the first to say, and we have long said, that that's not enough. We need to ensure more people and more communities are vaccinated. And it is now, we're reached a point where there are some communities, even states, where there's 70%, 80% or higher vaccination rates. Other communities where there's 40%, 50% or otherwise. That's not just a health issue. It's a huge health issue. It's an economic issue. We've seen how that can impact local communities as it may lead to shutdowns of different businesses. It's an economic issue as well. So, of course, we work in close partnership with our neighbors, but we have 162 million Americans vaccinated. We're the world's largest provider of vaccines to the global community. That's progress in our view, even as we've said from the beginning, there's more work to be done.